everybody. Welcome. Good afternoon. In case you're wondering where you are, this is the East Chapel Hill Rotary Club. My name is Nick Vaughn, and I'll be your Sergeant at Arms today. Welcome. We're glad you're here. We're grateful for our host, everyone here at Sunjar. We're grateful for the food, delicious. As much as anything, we're grateful for one another. And so by a small way of a benediction or a blessing, I'll share with you a phrase I heard from Father Greg Boyle, whose life work is Homeboy Ministries in Los Angeles. He says there are two guiding principles. Or number one, we're all unshakably good, and we belong to each other. Amen. Amen. Well, welcome. Do we have any guests today that want to pop up and introduce themselves? Yeah, thank you. Any other guests? I think I saw a visiting Rotarian with our friend Mary back there.
I am Mary Leafold, and I'm with the Durham Sunrise, and it's nice to have you guys out today.
She curls.
Right. She curls with Rob. Imagine. Let's get the fine basket started as well.
Nick, is this dedicated to the flood effort again?
Is this dedicated to the flood effort, President Tim?
Well, I didn't hear the question.
Is the fine basket dedicated to the flood effort?
Yes, it is.
Thank you, Russ. All right, y'all. Well, I had a little bit of time to think about what I wanted to say, and I have this. I wanted to talk football. And I don't know if y'all watched the Vandy game last Saturday. Did you guys see it? Rob, did you get to see that game? It was kind of a Revenge of the Nerds kind of thing. Like, how did these dorks put together an effort to destroy the best team in the country? And then it got me thinking, like, could we have a conversation around the nerdier side of football? Like, could we create like a 12-team playoff? Everyone pick their favorite author, let's say, from 6 ACC teams, 6 SEC teams, put them together. And it just sounded like a lot of work, so I did not do that. But I still think it's a good idea. But here was something in the initial research I was doing. Can anyone name, and DG doesn't get to play this game, can anyone name a favorite author that's an alumni of UNC?
John Gresham.
Okay. We're on fact check that. Someone else? Yes, ma'am, Julie. Thomas Wolfe. Okay, I think Freddie would approve of that choice. You got Walker Percy, Shelby Foote, a lot to choose from. Paul Green. Yes, very good. But then I started, yes, Julie. How about Frank Rooney? Yeah, great. But then how about, can anyone name a famous author who's an alumni of, I don't know, NC State? Coloring books don't count. And then I started looking at Duke, I started looking at Clemson, and actually it's a harder game to play than you might think. And so I just put that out there. If you're bored on your phone, you're tired of looking at football scores, start Googling your favorite author from particular schools. Interesting, and which schools claim which authors, because of course you can also only did undergrad here and graduate school wherever. So anyway, not really what I'm going to talk about today. But I thought that'd be a fun detour. And so Tim, we're going to try to keep this short. Let me know when I'm out of time.
You're fine. I was turning my silencer on.
Okay, Tim's putting the silencer on. So here's what I did want to talk about. And this is in some ways just a rehashing of some thoughts I've given to this group before. But we recently on the programming committee had something we bumped into that we run into from time to time. It's where basically we get a snub from an invited speaker. Almost as if to say, I don't know, a Rotary Club, like, is this really worth my time? So it got me thinking. We put together these amazing biographies, thanks to Jim and his team, of all our speakers. Like, maybe we should have a biography of the East Chapel Rotary Club. I don't know if you guys know this, but we're kind of a big deal. So you could share these thoughts, you could share your thoughts on this with potential speakers, potential guests, potential members. You could look in the mirror each morning and just kind of recite this to yourself to get psyched up like Alan does. And so I want to try to convince y'all we've got the best members of any club, certainly any Rotary club, no offense, Mary, on planet Earth. All right, here's some proof. We always say that our best speakers come from our membership. I saw Jody here earlier.
Yes.
Jody's kind of a big deal in her field. DG, kind of a big deal. Freddie Kinder, Fred McLaurin, Joe Jenkins, even Steve Fromney with his fuzzy dice is kind of a big deal. So thanks to all of y'all who've spoken to us. And when I even think about that group is the tip of an even bigger iceberg. Y'all are all a big deal. We are all a big deal. We have at least 2 police chiefs among our membership, professors, doctors, entrepreneurs, civic leaders. I guess we do have a few black eyes. We have some lawyers, Rob. We have Omar, whatever he is. None of us be perfect. But we've got some amazing folks in our membership, and I think sometimes I even take that for granted. If I haven't convinced you that we're the best club on planet Earth, yeah, think about our speakers that we've had. Our programming committee has brought you, just within the last year, Holden Thorpe, Valerie Fouché, Jess Anderson, Bubba Cunningham, John Montgomery, Aaron Nelson, a UNC provost, chancellor, board of trustee, Michael Walden, who's an economist at NC State. So we're equitable. It's a long list. And not that we're resting on those laurels. Jennifer Clare shared with us at lunch Wednesday. Thus far, this year, we've had 36% of our speakers are people of color, 36% are women. So we're good. We're even getting better. Still not impressed? Consider what our club has accomplished in the community. And y'all know this list. Joe and his team, that's extensive, serves dinner at the CQ house every Thursday. What a labor of love. Once a month. Guys, when you're in sales, you have to learn to embellish a little bit. And fact check. We'll fact check. This will be fact check later. We do bike night once a month. We do bike night once a year. Sorry. Teacher supplies store. The green team. Think about all that Lorenzo does with Ryland and the high school club. Just recently, Bob Woodruff and Tom Shea were recognized for all their hard work at the CQ House. Amazing. I think it's fair to say that our membership makes an enormous impact on the Chapel Hill community and beyond. Please hold on the page. Does anyone still need further proof that ours is the greatest organization in town and the best Rotary Club on planet Earth?
I do.
Okay, Rob does. The lawyer.
I'm just trying to help.
Fine. How about our social endeavors? Pop-up events, thanks to our social chairs, including Rob. The baseball game. The Carolina baseball games are going to do state night, holiday parties, and all the friendships. It was really fun thinking through all the relationships I have with various folks in the room. I love all of y'all. But I get to do the Wordle every morning with Rob. We share our Wordle scores with each other. I'm not sure we would do that if we didn't have this connection through Rotary. Does anyone here play pickleball? Neither does Alan Young, but he'll occasionally go out on the court with you and keep you company. I'm not sure that we get to do that without East Chapel Rotary. Golf, dinners, lunches, concerts. It's an amazing way to stay connected with just the most wonderful people that I've met in town. So I'll leave you with East Chapel Rotary certainly enriched my life beyond my highest expectations, for which I'm both grateful and proud. And it brings me back to our benediction. Y'all are unshakably good, and we belong to each other. Thank you.
Thank you very much, Nick. I tell you, if East Chapel Hill Rotary were looking for a job, I'd hire them. And hang on to that, because that might be my exit speech, okay? So hang on to that. Got it. Yes, welcome to another edition of East Chapel Hill Rotary. Just a few announcements. Chad, I'll go ahead. I'll start with you if you don't mind.
Great. Yes, I'm happy to do that. After that, because I think if we just say the people that speak, looking at the history of the speakers is amazing, and I'm so glad you reminded me. I've spoken here, and I'm the token nobody who has done so. But when I do conferences around and stuff I do, I sometimes say, "Here are the people who have come before you," and that's enough. I mean, honestly, that's a really amazing group of people that you put together, and I'm honored to have been part of that. So one of the things we do is this Mankind organization my wife and I founded 10 years ago. A lot of you have been part of supporting it and been involved with it. We have our first 10th anniversary. We've been around for 10 years. First 10 years is building this really innovative model, and we're celebrating it. Really, the things that we do are unique around the world. There are some organizations now following what we do. And so that's pretty exciting for us. We have our celebration of that next week. It's at Hope Valley Country Club. And you all have a special spot in my heart and in the organization. I would love to invite you. On your table, there's a little flyer. Of course, we have an option because we are a fundraiser. It is a fundraiser. We're a nonprofit. And if you scan this QR code, there's some really cool things that are being offered this year. One, always very popular are Masters tickets. There are 2 Masters. Actually, it's not the tickets that are for sale. It's a program. It's part of like a pencil and a couple other things, and the tickets come with it. So that's technically what happens. And there are a couple houses, one in wine country, and so you can see some really cool things there if you choose to do that. And truly, I would love for you to come because to me, the work that we do is about creating a movement around teaching differently around the world. And that movement starts with a whole lot of people like you involved. So thank you.
Yes, sir.
I wanted to tell you that I've been asked by the local Orange County and surrounding mayors to give this year's Veterans Address on the 11th of November, and I appreciate as much support as possible. I guarantee it will not be a standard boilerplate Veterans Day address.
We'll send you more information on that, and we can get that out.
I'll be providing more information, yes.
Very good. Just a couple more announcements. Via LEADoula, update on our bike night. I really want to thank LEADoula for her leadership on this, and certainly Ed's guidance as well. We have secured 50 bikes and helmets. These bikes retail for $425, and we're getting them for $116. LEADoula, thank you. We will need help from membership this year. A few volunteer opportunities will be to pick these bikes up from the Chapel Hill store for a bicycle chain and have them taken to Walker Brown's, one of his storage facilities. And then on December 6th, get them from that storage over to Binkley Baptist where the Christmas house happens. And then we'll need volunteers to help staff the bike room on December 7th, the next day from 7:30 in the morning to 6 in the evening. And if so, we'll send out a link and sign up. So if you can spare a few hours, particularly on the 7th, that'd be very helpful. Lida, and thank y'all so much. Thank you, Lida. That was good. I want to say thank you if you weren't able to read the scuttlebutt this week. Last week we made a plea to make donations to the North Carolina Disaster Relief Fund. Y'all responded in spades. We have met that match, and as of now, we have just shy of $20,000 going to that fund. So thank you. Please give yourself a round of applause for that. We now have kind of an opportunity to be more hands-on. Mark Hunt has a friend in the Asheville area who owns a wedding venue, and he's touched base with Mark to see if any of us would like to come up and be hands-on, boots on the ground kind of thing. With that wedding venue, he's got a commercial kitchen, and I think like 3 or 5 cabins that can put up a lot of folks. So maybe cook some meals for folks, first responders, people up there clearing the road, doing the heavy-duty work. Mike Clayton is going to be in touch with him tomorrow to hash out some of these logistics. So be on the lookout for that. So if that is anything you might be interested in going and spending a few nights, we'll get that out. So again, thank you for really responding for Helene's efforts. This we're struggling and will for a long time. But I want to go ahead and get to the introduction of our speaker. It is my honor and privilege to welcome my friend and colleague from UNC Family Medicine, Venus Standard. She helps out a lot with I run our patient advisory council, and she's been very helpful with that and helping our patients understand what our department does, especially in her capacity. I sent out in the scuttlebutt the link to the documentary of her work, and it's called Critical Time. Excuse me. And I implore you to watch it. It's really an amazing documentary. It won an Emmy, regional Emmy award. It's something that WRAL put on. I know her best through her LEAD initiatives, the Live Experience Accessible Doula, and I cannot be more impressed with this person. She is amazing, and it's not just me. It's nationally, it's worldwide. She travels, and she'll tell you all about it. But her efforts have garnered the attention of the White House, and I think she may be good friends with the Vice President at this point. So if you can bend her ear, then you're doing something right. But I won't hold it anymore. Please, Venus Standard, come up and
Hello and good afternoon. Good afternoon. My voice sounds a little crazy. I've been like this for about 3 weeks and we can't figure out why. So I'm not sick, just wanted to let y'all know that I'm like this. It'll go away, I guess, or maybe this is my new normal, I'm not sure. So Tim invited me to speak to y'all to let you know a little bit about my work, and it is just a little bit about what I do and why I do it. So this particular talk is about racial disparity in the perinatal health world, which is what I do. I'm a provider helping women and families and birthing people become parents and help their babies come into the world. And unfortunately, we have some issues in the maternal space that is just coming to light now. So my friends and colleagues and we wanted to do something about it. So this talk is particularly about one of the programs that we are doing. I first like to start with some disclosures. The ideas, opinions, comments, contents, and the conclusions described in this presentation is based on statistical data, research, along with lived experience. It should not be construed as the official position or policy of our current employers, nor should any endorsement be inferred by the conference organizers, you guys. I want to also do some acknowledgments. Although this presentation will use the term maternal or women will be used often, I understand that not all pregnant people identify as women, but the bias in the statistical data in this presentation is found based on women and more specifically Black women. But I wanted to acknowledge that. So today, the reality is you're going to hear some indisputable facts, some documented truths, and some appalling statistics. So there's 4 emotions that I expect from at least somebody in this room, and I tell people that because I speak to a variety of different people. Sometimes I speak to a room of young people. Sometimes I'm speaking to a room of educators. Sometimes I'm, speaking to a room of physicians. So everybody has one of these 4 different emotions that will come out of this presentation because this stuff is very heavy, and it will cause one of these emotions. So this awkwardness, that's really the first expectation, emotional expectation that you might have. You might feel a little uneasy also of some of the information that you hear. You may be angry as hell because some of the information will touch a chord for some people. And also then there's the person that doesn't believe it. You don't see it in your community, you don't hear about it in your community, nobody in your community has been affected by this, so it really can't be that much big of a deal. So some people actually will be a little taken back by this is not even true. So some of the learning points today is to identify the U.S. and the North Carolina health disparities in maternal and infant mortality and morbidity, understanding the importance of developing a culturally appropriate, concordant maternal workforce, understanding how does a doula bridge the gap between the underserved, the non-privileged, and the marginalized communities with today's medical system, understanding the role each of us play in the puzzle of injustice, which is extremely important, and examine and understand, own, accept, and correct our own personal conscious and unconscious bias, and respectfully help others understand, see, and correct theirs. So the agreement today is I do this in every talk, listen and understand the challenges and the feelings, and every person's story that's shared here stays here, but everything you learn here leaves here. So what is the problem that we're talking about? I started off talking about maternal mortality and morbidity. What is the actual problem? So really, the crux of this is the maternal mortality. So just so we're all on the same page about maternal mortality, there's different levels. So there's the maternal mortality that happens in the first 42 days, usually based on a pregnancy-related issue. Then there's pregnancy-related mortality that happens up to a year after delivery, again, pregnancy related, and then there's pregnancy-associated mortality, that something happened in that first year, non-pregnancy related, a car accident or something else, but the person still died within a year of giving birth. So this is a maternal mortality ratio chart by country, and if you look at this chart, this is the 11 of the high wealthy countries, and this is by the Commonwealth in 2020, and the US is ranking the highest for maternal mortality. We spend more per capita on healthcare, and particularly on maternal healthcare, but yet we have the worst outcomes in the world, right? In the world, we have the worst outcomes. So this is the club of the richest countries, and there's 38 in this club. We rank number 35 out of 38. Again, we spend a lot of money on our healthcare. Why are we 35 out of 38? I travel throughout the world, and I've been to some places where their healthcare is appalling. Their care and their ability to do and care for people are appalling. We have all the tools, but yet our numbers are so bad. This is a trend of the United States from 87 to 2019, and as you can see on the trend, the maternal mortality rates continue to rise from 87 to 2019. This is a different chart, and this one has race included into the chart. So you see non-Hispanic Black, non-Hispanic White, and Hispanic. So look at the purple, which is the one to the right, and you see that non-Hispanic Black, out of 100,000 live births, had 69.9 maternal deaths in Black birthing people, but only 26.6 non-Hispanic White birthing people. Now, for the person that doesn't like graphs and you like real numbers, I like real numbers because that real numbers show that it's a person. The graphs kind of give you like an overview, but this shows the real numbers. So this is the same exact chart, numbers that made that chart. So the non-Hispanic Black, there was 517 live births and only 362 deaths. Where non-Hispanic White, there was 1.8 million live births, but 503 deaths. So that's where that ratio comes in of 69.9% mortality rate to 26.6. Even though there was 3 times as many live non-Hispanic White, the mortality didn't match that percentage. So sometimes you think as you get older, you get wiser, and you may be immune to some different things and issues that's going on in the world. But again, look at this chart, and they got the color coding is the same. You see the dark purple now is non-Hispanic Black, and you see the non-Hispanic White in the blue dotted line. Look at the difference in the range. So it's that showing that same disparity in a different range, but based on age. So age doesn't protect you. You don't get a pass because you're older and you're a little wiser. So again, now this chart, same color coding based on education. You also think the higher level your education, the smarter you are, and you would get a pass. It has been determined that a person, a Black person with a upper level degree, doctoral level degree, versus a white person with a 8th grade graduation, 8th grade education. You would think that the person with an upper level degree would have a better chance. But look at these statistics, right? The Black person in the dark purple and the white person in the blue. Still, the ratio disparity is sometimes 2 to 3, depending on where you are. New York, it's like 10 to 12. So this, I always throw this in because this shows that this is not new. This has been going on for decades, and the CDC has been tracking it for decades as well. And as you look across the span, the disparity ratio is still the same per the category, non-Hispanic White to non-Hispanic Black. So, okay, some real talk, right? Non-Hispanic White women are 3 to 4 times more likely to have a positive outcome. Now, some of these charts show the opposite wording. 3 to 4 more times Black women are likely to die. But this one lets it hit home a little differently. Non-Hispanic White women are 3 to 4 times more likely to have a positive birth outcome. Non-Hispanic White women are 2.5 times more likely to live after birth. Non-Hispanic White babies are 3.8 times more likely to live from birth-related complications. Just sit with that for me, right? That says a lot. The significance of the problem is 80% of maternal deaths are preventable. So how come the ratio is so high? The divide is so far. If 80% of those deaths are preventable, based on the CDC, for every maternal death, there's about 70 who suffer severe morbidity. Social determinants of health, the structure and structural racism and sexism are primarily drivers of this disparity. Barriers also include the lack of access to quality care, maternity service, and poor coordination. So this chart, so we've been talking maternal death. So the March of Dimes, they keep a hold and track of the infant deaths. So as a United States grade, the United States got a D+. And again, that's based on all the other countries that we're compared to, but the United States got a D+ in preterm births. North Carolina got a D. Out of all the states, North Carolina gets a D. The infant mortality rate is 6.8. Preterm birth is 10.8. So what I did here is this is North Carolina, and again, you can see from the March of Dimes information, you can see Black babies that die versus white babies. This is per 1,000. Again, this is now our triangle, because that's the area we live in, right? So I did and pulled out the numbers for our triangle. So you can see that Durham County and Orange County and Wake County, our rates are skyrocketing. For Durham County, 4.42%. For Wake County, 4.13, and that's based on 2019 numbers. Okay, so I'm gonna give you some statistics. So what's the problem here? So the problem isn't race, isn't the problem. Racism is the problem. Racism is a system of structural opportunity and assigning values based on social interpretation of how one looks, which is what we call race. It unfairly disadvantages some individuals and communities while giving an unfair advantage to other individuals and communities. Race inequities is a persistent force in producing significant disparities in the health and healthcare. And that's by Dr. Kamara Johnson. So in 2025, why are we still facing problems like this? If I did a talk in Chicago, and it was a room full of about 200 family medicine physicians, and when I said this, he says, your numbers are flawed. Somebody in the audience said, your numbers are flawed. That has to be from like the 60s or the 70s. It's because it's inconceivable that in 2024, 2025 almost, that we're still faced with this. This is a page out of one of my medical textbooks. They taught us how to respond to people based on their race. Based on their race. And this was actually just pulled about 3 years ago, where the publisher was sued and he went and made a public apology. It wasn't just this book, it was several books, several medical books had different excerpts about how to care for people based on their race. Now, if you look at the bottom left, it talks about Black people. And this chart was based on pain. So basically, that little passage down there, Black people often report higher pain intensity than other cultures. So the answer to the question, if you wanted to pass the test, was don't believe that. What they tell you is really not true because they're exaggerating your pain. That was the answer to the questions, because we were tested on this. This was the chart that the man in the audience disputed. And this was a study done by NIH that gave your general public, your first, second, third year medical student and residents this survey. Black people age slower than whites. Nerve endings are less sensitive. In other words, we don't feel pain the same. Our blood coagulates. Our brains, white brains are larger. Black people's skin is thicker. Like all these things. This is not my survey. This was a survey done by NIH. And this is what he said, oh no, that has to be old. And when I pulled it up, he could see I came off the podium with my laptop and opened up this study to show them that it was 2016. I think he thought I was kidding. I said to him, how many people in your practice look like me? How many people that was in your medical school look like me? So if I call it the not in my backyard syndrome, if it doesn't affect you, if it doesn't affect anybody you love, anybody you know, it really can't be a thing. And that's where he was with this. He didn't believe it. So these are different, talking about pain. They've done different reports and articles on pain studies, and they don't feel pain. People really, really believe that Black people don't feel pain. They're undertreated for pain. And this is probably all based on that survey that NIH does. It's a real thing. People really do believe this. And it's not just adults, they do it to children too. 12.2% of Black children were given pain medication for appendicitis, where 33.9% of white children were given. Why did children? Do you really think that they're exaggerating their pain if they tell you they're hurting? They're not. So this is something that people like me deal with all the time, every day. Again, where are you in those four, right? You got one of those four emotions. I know you did. Because everybody does. When you see the statistics and when you see the ads and when you see the articles and when you jumped into one of these categories by default. So I need you to listen closely. It's not race, it's not the problem. Racism is the problem. Black women are dying as a result of this systemic racism. Our pleas for medical attention go ignored. routinely we experience unconscious bias. And people will say, I'm not prejudiced, I don't have racism, I got a black friend, we're good. Right? Pregnant person, especially postpartum women, their concerns are dismissed and not believed when something is wrong. So why is this coming to light right now? And that's because people that we now see on TV are now bringing it to light. In medicine, we have something called near miss. You're here, but you were almost not. Serena was almost not. Serena almost died. We know Serena. We know the power of her body, and all them zeros in her bank account is because she knows the power of her body. Why wouldn't they believe her when she told them something was wrong? Serena almost died. They didn't listen to her. And she's going and talking her story, and she's making it known. We know this young lady too. A lot of zeros in her bank account as well. Again, not believed. Different case, different scenario, but she wasn't believed. In Serena's case, she had to actually go to the desk and say, I am asking for this. Serena came into pregnancy with a clotting disorder. So her providers instructed her, look for this, if this happens, let me know right away. So she was prepared, and when it happened, the staff at the hospital just poo-pooed her off. She had to then go to the front desk and act like the angry black woman to get some attention. When they finally did what she asked, because she knew exactly what she needed. They found a blood clot that was moving. Had she been the good little black girl and went back to her room as she was instructed to do, Serena would have been dead because the clot had broken off and it was moving. It would have went to her lungs, it would have killed her. But fortunately, she had to demand attention. We shouldn't have to demand attention. We need to, like I tell our residents in family medicine, you treat the person in that bed like she's your mother, your sister, your wife, your daughter. How would you want your family member to be treated? Beyonce, same thing. After the birth of her twins, she wasn't believed. Beyonce, for a different medical reason, almost died as well. So see, we already determined that age doesn't give you a pass. Education doesn't give you a pass. And your socioeconomic status does not give you a pass. You would think that that would, but it doesn't, right? So if you look at that, you put that in the pot, and the only thing that comes to the surface is the difference in race. So all these people that were near misses would have been. This young lady, this happened just last year, you may have heard about this on TV. Again, wasn't believed. An athlete knows the power of her body, and she wasn't believed and she died. This person you may not know. This is Kira, husband Charles. Now, Kira had a planned C-section, so don't think that that was the problem. This was her second child, and she had a planned C-section for whatever the reason. But C-section was at about 2 o'clock. So she's back in the PACU at about 3 o'clock, right? And you stay in PACU for about an hour, maybe 2 hours, then you go to postpartum. I know this hospital. This hospital's in Beverly Hills. Kira and Charles wanted to come into the hospital as regular Mr. and Mrs. Black people. They did not want to be known who they were. Actually, they did not want to be known whose they were. Not who they were, but whose they were. They didn't want that. They wanted regular treatment because they were regular people and deserved regular care. At about 4 o'clock, Charles said, there's a little bit extra blood in that Foley catheter. Can we check that? Nurse documented. Nurse called the physician. She came in as regular Black people, remember? When you come in, again, I worked in that hospital. When you come in as somebody that's famous, we get in service, we get what to say, what not to say to the press. We get this, we get that. They get a private chef that comes up the back thing with a top hat and everything. When you're known, but when you come in as unknown, you get whatever. Charles went 5 o'clock. Can somebody check this? 6 o'clock. Can somebody check this? Doctor said, yeah. Because I called, because I used to work there, I knew the staff. I was like, hey, what happened here? He said, doctor was called. Doctor never came back. Never came in. 7 o'clock, 8 o'clock, now the bag is full of blood. and nobody's tending to cure him. Doctor shows up. So at about, I think it's 8 o'clock-ish, a stat scan was ordered to see where this blood was coming from. Stat means right away. Stat means right away. It was about 11 o'clock and the scan still hadn't been done. Right? Doctor shows up, got tired of being called by the nurse. He says, don't worry, we're gonna take her back to the OR, open her back up, she'll be back out in 15 minutes. Mrs. Charles, I brought Charles to Family Medicine, to the hospital, and to the North Carolina Medical Society to tell this story. Because it's one thing when you see the story in ads or news, is another thing when the man is standing in front of you crying because his wife is now dead. So the doctor comes back, and Kira says, I'm scared. I'm scared, please take care of the boys. I'm scared. As their hands do like this, as they take Kira back down the hall. They open Kira up, she had liters of blood in her abdomen. Something had been nicked. Had she had attention at 5, 6, 7, 8, Kira may be here. But with the blood shift, she immediately coded and died right there on the table. Right there on the table. Then they found out whose they were. Charles is Judge Hatchett's son. Had they had known, different situation. But you shouldn't have to prove whose you are to be able to receive proper care. They didn't want nobody to know whose they were. But unfortunately, because of that, he's raising his 2 sons alone. This is his timeline of everything that happened. And he posted this, 3 liters of blood she had in her abdomen. Again, why are we dealing with stuff like this in 2024? This wonderful person is the senator of Louisiana. Louisiana has 50% black people, which means they have 50% white people. Their numbers are crappy like our numbers are. With a mic in his hand in front of people, he says, our numbers will be fine if you just don't count the black people. Are you serious? Then clearly you are the senator for half your state. Because you wouldn't say that if you were the senator for the whole state. Or if somebody you love was in that other half. Just don't count the black people, he says. He tried to backpedal, but when you have a knee-jerk reaction, somebody tells you something, believe them, that's the real them. That was the real him. Thank you so much, Senator. Don't count the black people. This was one of his statements about one third of our population is African American. African Americans have a higher incidence of maternal mortality. Well, we're trying to tell you that. Yeah. So if you correct our population for race, we're not as much of an outlier as otherwise appeared. Now I say, not to minimize the issue, but to focus on the issues where it would be, come on now, dude, really? You still saying, don't count the black people. That's what you're saying. Because they're making your numbers look bad. So what's the solution here? We done heard about the problem. What's the solution? Is having a doula the solution? No, having a doula is the missing piece to the puzzle. And that has been researched and determined. ACOG has put out position papers on that. In 2014, ACOG says the safe prevention of a primary C-section is to have a doula. In 2017, approach to limited interventions is to have a doula. This is ACOG, and this is the one that governs most of our care. They give recommendations on how to care and take care of people. They say have a doula. So therefore, they're not going to say that willy-nilly. That was because the research determined that. So these are the benefits of having a doula. Because there's continuous support. When you have medical staff, they're there at 7 and they leave at 7. Both the nurses and the doctors. The doula gives continuous support. If the labor takes 36 hours, the labor takes 36 hours. The doula's there. There's an increase in oxytocin, increased mobility, increased self-esteem, decreased pain, and decreased anxiety. All of these things equal a shorter labor, higher birth satisfaction, more vaginal births, decreased C-sections, and better baby outcomes. Now, when you have proven information like that, why wouldn't you buy this item that's going to do all that for you? Why wouldn't you? But we're still fighting with insurance companies to do that. So this chart is a little old, but the numbers really haven't changed. There's about $126 billion spent on maternity and newborn care. 1 in 3 are C-sections. It's about 50% more cost. There's a lot more people in the room with a C-section. In a vaginal birth, you have 3 people in the room, three professionals in the room. With a C-section, there's sometimes 7, 8, 9. So that's a lot more cost there. And then you got anesthesia, and you got the facility costs, you got all these costs. But doula has been proven to save about 28% of that. So just look at that number, 28% of all that money, that's a lot of money saved. Why wouldn't you just pay the small amount to be able to save all that money? And insurance companies just don't get it, not sure why. So what are the barriers, right? The barriers to being a doula, having a doula. So it takes time. Not as much time as it takes to be a doctor, to be a nurse, to be a midwife, to be a whatever. You can become a doula in a short amount of time, but you still gotta have that time. You still have to be able to block your calendar for the time you need to be there. And there's a cost to it. It's not free. It's not covered by student loans, it's not covered by student aid, it's not covered by any of those things. It's an out-of-pocket expense. And that's an out-of-pocket expense that some people cannot afford. They have kids to feed, $10 a gallon gas to put in their car, and all the things, food costs. So those are barriers. Some of the biggest issues though, some of the biggest barriers are the attitudes in the hospital staff surrounding doulas. Microaggressions toward doulas, or the client that has a doula. You come in with a doula and a birth ball in some hospitals in our area, dark blue people, and they go, oh, she's gonna get a C-section. You've already predetermined just because she has somebody here that's there to support her. That's unfair. Not understanding the benefit and the value of a doula to have on the team, not understanding the role of a doula. A doula is not there to take anybody's place in that room, including her partner, her mama, her sister, her bestie. That's not the doula's role. The doula's role is there to support, to educate, and to help her advocate for herself. Not to be her mouthpiece, but to help her advocate for herself. They're not looking at the benefits, they're just looking at the cost. This costs a lot of money, but you're saving so much more. So why can't you see that? And there's a lack of private insurance and Medicaid. Our state is one of a bunch that haven't allowed Medicaid to cover doula costs. Some other states have pulled the trigger and Medicaid's covering it, but Medicaid's covering it at a really slow, low rate. You wouldn't expect that nurse to be there for 36 hours and not gonna pay her, not only her rate, but overtime or whatever. But yet they wanna pay doulas $500 for 36 hours. That's unreasonable. You'd make more than that working in Burger King. And that's unfair for the amount of benefit that everybody in the room is gonna get, just the fact that the doula's in the room. So this is the insurance layout across the state. And a student that was getting her PhD, actually she is an attorney, was working for the state, and when I did a presentation at Medical Society, she got really hyped on it and decided to go back to school to get a PhD in maternal health. So this was a part of her thesis, and she researched all the states and the insurance companies, and look at North Carolina over here, proposed but no progress. Thanks, North Carolina. Again, doulas are not the answer, but they are the missing piece to the puzzle. So 2 of my friends and colleagues, in the purple is Dr. Jackie McMillan Bowler, and she is a professor at Duke. And on the right is Dr. Stephanie Devane Johnson, who is a professor at Vanderbilt, and I'm a professor at UNC. So, and we're all certified nurse midwives. So together, on the heels of the near misses of Serena and Beyonce, which was just like a year apart, we were like, what can we do? This is crazy. So we got our heads together and decided, I had been a doula before this level of medicine, and I knew that that was a possible missing piece to the puzzle. So that's what we decided to do. Got our heads together and had an idea of a doula program. This is a birth that I was fortunate enough to witness in Greensboro, and I walked in to the room, to that upper left picture, and I see these two amazing doulas and a partner supporting this patient. The nurse is just sitting in the corner because she didn't know what to do because they had it, right? She just sitting there. They had it under control, and as you see, they never left her side, even when she took a nap. They were right there. That's what continuous labor support is about. I signaled to the partner like this, if I could photograph the whole thing, and he nodded his head, so I just stood in the corner and took pictures. They didn't need me right then, so I just did my job, which was take pictures. So we talked about this program and what could it bring. So we wanted to increase access and remove all the financial barriers to a doula training. So pre-COVID, I had an office in Greensboro, and I would do doula trainings 2 to 3 times a year. And doula trainings were approximately $1,200 for the doula training for a 3-day workshop. So not everybody, again, can afford that. So we wanted to remove that. We wanted to increase the access and remove the financial barriers to obtaining a doula for your birth. Again, in this area right now, the cost is from like $1,200 to $1,500. Not everybody's willing to afford that either, or can afford that. We wanted to improve Black birthing persons' birth outcomes and increase their experience and satisfaction with the help of a professionally trained Black labor support doula. So we already saw on the statistics, on the things from NIH and on the things from ACON, that doulas make a difference. So a concordant doula, a doula that looks like you, that could have the same lived experience that you do, if nothing else, you know that this person got your back in that room because everybody else don't look like you. So you know your odds are already on the wrong side. So having somebody there that understands the lingo, that understands what they're doing and what they're supposed to be doing is crucial, crucial. So we wanted that for people because everybody can't afford it. Supporting the doula mental and emotional health as well, increasing her personal accomplishments and self-satisfaction while helping others develop helping her develop a sustainable doula business that may improve her own generational health for her and her family. That was our goal. Yes.
I don't want to stop you, but we usually have to stop at 2 o'clock.
Oh.
But I don't want to stop you, but some folks may have to leave.
That's fine.
Is that okay?
That's fine.
Okay.
No problem. No problem. So these are other programs throughout the country. So ours isn't new, but we do have a kind of secret sauce going on. So we're not new, but there are other programs around the country. Things that people have been talking about it because it's a thing right now. It's being brought to the attention. So I put together what I call my village of people, of medical professionals, everybody a professional in the OB world, but they all have a niche. And there's 28 of them, but this is just a few. And they come in and they teach. I extended the program from 3 days to 8 weeks. And everybody comes in and I fly them from all over the country if they're not local to come in and teach their part. So we had developed the LEAD program, the Lived Experience Accessible Doula. Again, that person could have the same lived experience as that patient in the bed. So we were all excited, and then we started, high-fiving each other, and then all of a sudden, Stephanie says, "So who's paying for it?" I go, "Oh, we don't know." So again, pulled out, I'm telling my age right now, pulled out my Rolodex and started searching for different people that could maybe sponsor us. So I reached out to everybody here. They were like, "Venus, that is an awesome idea. We ain't giving you no money, but that is an awesome idea." But what they did was give us a letter of support. And I was able to take that letter and present it to the C. Felix Harvey Foundation, which gave us our first grant. It was a small grant, but that's okay. It allowed me to show my value and my worth and what I could do with that small grant. It was a 1-year grant to train 20 Black women to be 20 Black doulas to support 60 families. So that ratio is 1 to 3. So it's 1 to 3 because certification, you have to have supported 3 families to apply for certification. So that's why it was 20 doulas to 60 families. And we have 1 year to do that. The first set of doulas hit the ground in 1st of July. Their training was May and June, so they were on the ground in July. And I want you to remember that, July 1st of 2021, because that will come up later, and I want you to remember that. But by December, so we've had from July to the following July, but by December we had trained our 20 doulas as promised, and we had supported 80 families in that 6 months instead of 16. This is some of our training that takes place in my Office of Family Medicine. So this is cohort number 1, that was July of 2021. This is cohort number 2, that was September of 2021, and they were divided because we were in the heat of COVID, and I wanted to make sure they felt comfortable in the room, so I divided them in half. So there was 20 doulas trained. By December 15th, 12 were certified, 80 families were supported instead of 60, and 100% satisfaction. So this was the chart I wanted you to remember, 2021. This was placed at the back of the labor and delivery unit, not by me, but by the guys that do. And they put their satisfaction rate. They were also proud of this, that in July of 2021, their satisfaction rate was 51.43. But now November of 2021, their scores had raised to 75. Wow, what was the difference? How about that? The Black doulas were on the floor. They had already had another group called the Birth Partners, which I know the director, but 99% of them are, that's stretching it. 98% of them are white. So again, you don't have that lived experience, you don't have that concordance. But when the Black doulas hit the floor in July 2021, the satisfaction rate of the patients rose all the way to 75%. So now, in 6 months, we had already accomplished and done everything we said we were going to do in a year. So I went back to those same people and said, hey, can you just erase the date, put a new date, and let me apply to something else, right? Look at what we've done in 6 months. So they did, and then we got the Duke Endowment, and theirs was, Duke can't let UNC be outdone. So they said, we're going to give you enough money that you can train 120 doulas and support 360 families, that same 1-to-3 ratio. Great. So here's cohort 3. Cohort 1 and 2 got a little salty because I bought cohort 3 some t-shirts. But that's okay. Here's cohort 4. Here's cohort 5. Cohort 6. 7. Can't figure out why cohort 7 was so small. I don't know. Something was happening that time. And this is the current cohort. Today is week number 5 for them of their 8 weeks. So this is cohort 5. In that mix, in these last 3 years, UNC in Chapel Hill was named by the best U.S. News and World Report as the best maternity hospital to give birth in uncomplicated pregnancies, and they cited us in there as well. Now, of course, they couldn't just cite us; they had to cite the other group too, even though they didn't change the numbers, but they were there, so they cited them as well. So collectively, in these numbers as of April 1st, we had. We were supposed to have trained 80. I have been trained. 56 had been certified. 13 were pending. These numbers are different now. 204. We had 240 births, we were supposed to have 240 births, which was 3 per doula. We had supported 368, not 240. Of our numbers, 265 were vaginal, 103 was C-section. But of that 103, 25 were scheduled, so we don't count that in our numbers. 75 were unscheduled, unplanned. So where the country in North Carolina has a 30% rate, having a doula in the room, our rate was only 20%. And just thinking about it, since these numbers, I don't think we've had a C-section, but we've serviced more families. I think we're up to like 450 now. Again, the solution, no, not the solution, but definitely a missing piece to the puzzle. So people had started getting wind of us, and everybody was coming out wanting to interview us, the newest and the latest and the greatest. So all of these places had interviewed and done documentaries, as you got to see one. So these are all of the stations and news reports that had some media attention, and it even went to the White House. I was doing a presentation for an audience in West Virginia, and I was doing it by Zoom because I couldn't change the elevation because of my eye issue. And I get off the phone, so it was on Do Not Disturb. My phone was on Do Not Disturb. And when I came off, and I should have put that in here, when I came off the Zoom and opened it up, there was 4 missed messages from the Vice President. And I was like, dang it, what did I do? 4 missed messages. And when I finally called back, I got part of her staff, and they said she wants you to come to her tomorrow. She wants to do a commercial. And that was last April, like 9th or 8th or something like that, and it aired April 11th. April 11th is the first day of Black Maternal Health Week, and she wanted that to air that day. The White House has its own blueprint on maternal health crisis. And these are some of the things she outlined. 80% of doulas in the United States are white. The lack of diversity is clinically providing and non-clinical providers is troubling. So this was acknowledged by the White House as well. Okay, here we go, back to those same emotions. I know you've picked one. So today's takeaway is to examine, understand, own, and accept the biases that you have in the role that you have played in the puzzle of injustice. What you can do is acknowledge that you have bias, because we all do on some level, but you need to acknowledge yours. Let others challenge your assumptions and beliefs. Be open to feedback and embrace diverse perspectives. And this was a Harvard Business Review study. This is some of other organizations that you can reach out to for more info, and this is our contact info.
I want to wish everyone a great weekend. Can you stay around for a few minutes?
If anybody wants questions, I will stay.
Okay.
Okay.
Well, thank y'all. Thank you so much for a great meeting. Go